So first, I would plan my medication administration. Um, for no interruptions, I would close the door. I would not receive or take any phone calls. I would also limit communication with my colleagues unless it's for essential information. I'd also adhere to the no interruption zone policy. So I've done that. So now I'm going to compare the care order form to the medication administration record. So Jaguar Jones, date of birth 08/25/1963, date of birth 08/25/1963, MR number 4176352, MR number 4176352. So then we'd see his allergy penicillin, medication morphine sulfate, route IM intramuscular, dosage 5 milligrams, times, the time is every 4 hours, and indication, PRN pain, so as needed for pain. So the indication would be like, does he need the morphine sulfate, or why does he need the morphine sulfate? And it's for pain. And is morphine sulfate the correct medication for pain? And it is. So once you've done that, then you do the documentation. So all elements of legal prescription are included. So once you've compared the two, you can set aside the order form. You would do hand hygiene, and then you would do the 7 rights of medication administration. So I'll just go back down it. So Jaguar Jones, date of birth 08/25/1963, MR number 4176352. And now we start off with the medication. So morphine sulfate, so they both match. And I will check the expiration date 12/20/2025. Show the camera. So it's unexpired. So now I will go to the route, so intramuscular. So for the intramuscular route, I'm going to use a 3 milliliter syringe with the blunt plastic cannula. So now we have the right cannula and syringe for the intramuscular draw. But before we can, so next is dosage, so 5 milligrams of dosage. But before we can do the dosage, we have to sterilize the top of the vial. Sterilized. So then we would calculate the dosage. So it's 5 milligrams, and the morphine sulfate is 10 milligrams per milliliter. So if there's 10 milligrams in 1 milliliter, I'd have to half that milliliter to get the 5 milligrams that's asking me for. But before I do that, I would remove the cap, and I would draw half a milliliter of air. Okay. Then I would insert it in the vial and inject the half milliliter of air. And then I would draw half a milliliter of morphine sulfate. I'm just going to go back and forth to remove some of those air bubbles. Okay. As you can see, I got half a milliliter worth of morphine sulfate. So now we're going to recap it sterilely. Okay. And now we're just going to make sure we got all this correct. So we're just going to double check it real quick. So morphine sulfate, intramuscular, so we have the right syringe, and we did the right cannula for the draw. And then the right dosage is 5 milligrams. So it's 10 milligrams per milliliter on the vial. So we needed to half that milliliter to get the 5 milligrams that's asking us for. And now we're gonna go over the time, so every 4 hours. So he hasn't had his medication done in the past 4 hours, so we're clear on that. And the indication is PRN pain, so as needed for pain. So why would he need morphine sulfate for pain? And is morphine sulfate the correct medication for pain? It is. And the documentation is all elements of legal prescriptions are included. So we've done the first 7 rights of administration, and now we're just going to go straight back through it. So we're going to start off with patient again. So Jaguar Jones, date of birth 08/25/1963, MR number 4176352. And then we start off with the medication once again. So morphine sulfate, intramuscular. And at this point, intramuscular, 5 milligrams. And we calculated the dosage, but we can do it again. So it's 10 milligrams per milliliter. So if it's asking for 5 milligrams, we have to half that milliliter to get the 5 milligrams. So we got the correct dosage. And every 4 hours is the time. So they haven't had it in the past 4 hours, so that's good. And the indication is PRN pain, so as needed for pain. And the indication would be why would he need morphine sulfate, and is morphine sulfate the correct medication? And he would need morphine sulfate because he is in pain, and morphine sulfate is medication for pain. And the documentation is all elements of legal prescription are included. But before we can finish with the 7 rights or the documentation, we are going to label this syringe. But for time's sake, I've already done it previously. So you would put down the drug, the dose, and the patient. And then you would make sure not to cover the measurement on the vial of what you drew up. So just put it down here to where it's not blocking the measurement that you drew in the syringe. And then you would gather your equipment. So you have that. So once you're done with the documentation, you make sure you got everything right. So for the intramuscular, we will need the 23 gauge needle. So I'm just going to equip that. Okay, so now we have the right needle for the intramuscular route, the right syringe, the right dosage. So now, since we did the 7 rights of administration, I went over the 7 rights. Now we can go to the patient's room, but for the video sake, we're just going to take a step over, and for visualization, this is going to be the new work area. But before we enter as we enter the patient's room, the first thing we do is hand hygiene. And then I would greet Mr. Jones. Hey, Mr. Jones. So then I would explain the procedure to him. Today we're going to be administering you morphine sulfate for your pain. And then you would raise the bed and lower the side rails. Sorry about that, excuse me. And then you would raise the bed, lower the side rails, and then you would start the 7 rights of administration. So first, you would start off with the medication. So you would check it again. Before medication, you would do the pre-assessment, which is blood pressure, respiratory rate, and you would assess his pain level. And then you would go to medication, and do just the normal 7 rights again. So it's morphine sulfate, intramuscular, so we have the right needle and syringe. And then dosage, we calculated the dosage, so 10 milligrams per milliliter, and it's asking for 5 milligrams, so we need to half the milliliter to get the 5 milligrams, and we have the 5 milligrams in the syringe. I can see the half milliliter marker, so that is correct. So the time is every 4 hours, and so assessment. Oh, I'm sorry. So you would do the patient first, then medication. So sorry about that. So you would do the patient first. So Jaguar Jones, you would you would compare the wristband to the MAR. So date of birth 08/25/1963, date of birth 08/25/1963, MR number 4176352, MR number 4176352. Sorry about that. Then you would go to medication, and it's morphine sulfate, intramuscular. We have the right needle and syringe. And the dosage, we calculated the dosage, 10 milligrams per milliliter, so you'd have the milliliter to get the 5 milligrams I was asking for. And the time is every 4 hours. Every 4 hours. And as you should have gone through the patient names, you would have done the allergies, so penicillin, and then you would discuss with Mr. Jones, hey, Mr. Jones, are there any other allergies you would like to discuss with me or notify me before we go into any further action? And then you would go into the medication as I just showed. So you would show the medication, the intramuscular syringe and needle, the dosage, how we calculated it, and I have half a milliliter because that's how much you have to draw to get 5 milligrams from the vial. And then you would go to time, so it's every 4 hours. So I see it hasn't been done in 4 hours, and the indication is PRN pain. So as needed for pain. So is morphine sulfate for pain? It is. That's an indication. And the documentation. And then on this third one, you would also check the label. So morphine sulfate, intramuscular, morphine sulfate, 5 milligrams, Jaguar Jones, drug, dose, and patient name is going to be on the label. Sorry about that. And then you would, I was at documentation. So at documentation, you would state that all of the elements of the legal prescription are included, and then you would don your gloves, okay, so once you have your don gloves, then you would don your goggles. And then you would find the injection site. So first you would put the palm of your hand at the greater trochanter, at the greater trochanter, and you would point the middle finger toward the iliac crest, and the index finger toward the anterior superior iliac spine. And once you find this injection site, you can palpate to check for muscle integrity and also check for muscle bruising, or bruising on the skin. So once you've done that, you will take an alcohol pad, you would go inward to outward, making sure not to touch an area you already cleaned. So once you've done that, uncap your needle. Then you would inject the needle. Then you would aspirate for blood. No blood. Then you slowly inject. Okay. Then you would take alcohol pad and apply gentle pressure. Okay, and then you would get rid of your uncapped needle in the sharps container. Then once you've done all this, you will then arrange Mr. Jones in a comfortable position, lower the bed and raise the side rails. And once you've done that, you can doff your gloves correctly. My trash can is down here. So I'll doff my gloves correctly. And once you've doffed your gloves, you will go back and check the injection site for allergies. After you doff your gloves, then you would do hand hygiene. Then you would go back to the injection site and check for, sorry, I have really bad dry throat right now. Then you would inspect the injection site for any allergies. Once you've done that, then you will document the procedure and document the pain level of Mr. Jones. You would document the procedure and you would document his response. And then later on, you would come back to reassess his response. And that is the medication administration record.